Hi, I'm Tim Mooney here with Ben Loberg, who is our resident expert on Medicare for the FSB Investment Center. Ben is here to give us an overview of Medicare. Ben, let's start with some questions. First of all, who needs to enroll in Medicare and when?
Enrollment has very specific rules. If you don't enroll on time, you may pay late enrollment penalties forever, and your healthcare expenses may not be covered by insurance. Everyone must enroll in Medicare when they turn 65, unless they're covered by an employer group plan that covers 20 or more employees. I'm now going to refer to that as the employer group plan. This employer group plan coverage is based on you or your spouse's current coverage.
Okay, so Ben, tell us about the different parts of Medicare.
Medicare is divided into 4 different parts. Part A is hospital insurance. Part B is medical insurance for services such as doctor visits and procedures. And Part D is prescription drug coverage. Part C is an alternative way to get Medicare, which takes me into my next topic. There are 2 different ways to have Medicare. The first way is called Original Medicare, and it has Parts A, B, and D all separate, plus the option of purchasing a Medicare supplemental insurance plan, which I'll touch on later. The second option is Part C, also known as Medicare Advantage. Medicare Advantage plans are offered by private insurance companies. With this option, you can think of getting all of your Medicare services under one plan, like an HMO structure where there's a network of medical providers.
So when and how should people sign up for Medicare?
Those who are receiving Social Security when they turn 65 are actually automatically enrolled in Parts A and B. Parts C and D are not automatic. If you want a Medicare Advantage plan, a Part C, or a drug coverage, Part D, you have to proactively enroll. You should do this before your 65th birthday. For people who are covered by the employer group plan, when they turn 65, they are not penalized for not enrolling in Medicare, but will be penalized if they don't sign up during their special enrollment period, which is 8 months after their current coverage ends. However, the best time to sign up is before your current coverage ends. That way you'll leave no gaps in your health insurance.
So is there a cost to Medicare?
Yes, there are costs that come along with having Medicare. There are premiums, deductibles, and coinsurance, and they're broken out by the different parts. Part A has no monthly premium as long as you or your spouse has paid into Social Security for 10 years or more. Part B has a monthly premium that adjusts annually, and Part D is handled through private insurance companies, so the premiums vary by plan. All parts of Medicare have deductibles and coinsurance as well.
So tell us what Medicare covers and what it does not cover.
Well, Medicare covers the first 60 days of hospitalization, minus the deductible, of course. Typically, it covers 80% of your doctor's visits and does cover some of your preventive services as well. The best reference for finding out what Medicare covers is the Medicare and You Handbook, which is a free resource. You can request one online at medicare.gov or by calling 1-800-MEDICARE. What it doesn't cover are things such as long-term care, dental and vision care, or hearing aids, to name a few.
It sounds like there are some holes in what Medicare covers. Is that what Medicare supplemental insurance is for?
You're exactly right, Tim. As good of a program as Medicare is, it still leaves an awful lot of costs out. So Medicare supplemental insurance is a great option to cover those gaps, such as the deductibles and coinsurance. This is why you often hear them referred to as Medigap policies. Medigap policies have a letter system ranging from A through N, and each letter has different coverages. They are standardized by Medicare, meaning each letter must cover the same things, but they can vary in price by insurance company or location. It is important to shop carefully and get the best plan that fits you. Again, the Medicare and You Handbook and Medicare.gov are great resources.
So what, Ben, are your recommendations for people before getting signed up for Medicare?
I recommend doing some homework before you turn 65. First, talk to your current insurance provider and ask them how your insurance works with Medicare. Then begin shopping for either a Medicare Advantage plan, Part C, or a drug plan and a Medigap policy, which are all done through private insurance companies. Every drug plan is slightly different, and they cover different drugs at different levels. So it's nice to shop for a plan knowing the prescriptions you already take.
It sounds to me, Ben, like people should contact you with their Medicare questions. So visit our website or see our contact information below and give Ben a call.